our Health Department Director, Jen Murphy, Board of Health Chair, Kathy Donahue, I believe Frank Hackett, Superintendent of Schools, will be joining us. And there's Frank. So the main purpose of this meeting is for the Select Board to hear a report from Jen Murphy as Health Department Director about the current situation in Winchester and the state during this surge of the COVID-19 pandemic, and also hear from the schools, the situation there, and then give the Select Board a chance to understand what better ways or new ways there might be for the Select Board to support the town's efforts and the Health Department's efforts, whether financial or otherwise, implementing any further measures or enhancing communication out to residents. In the interest of time, since many of these folks have worked a full day already, we will not have a designated session of public comment, but I'm sure, as I see there are many members of the public here, and I'm sure that they might have questions about what's being presented. So if you don't mind, rather than being called on, please feel free to put those questions into the Q&A function in Zoom that we can save, and we can try to get the information out to you in the next few days. You could also write an email. We do read all the emails that we get, or I read them all. I'm sure they are read by all of us. And so if you want to communicate with us, that's another avenue. Kathy or Frank, Beth, do you have anything you would like to add at this moment?
I don't have anything to add right now. Dr. Hackett and Jen and I have been working over the past few days. Obviously, this is a tough time for everybody as we're coming back from the holidays. So we've been working to kind of put our heads together to do, to see what we can do to try to get our hands around this issue as we try to navigate the next probably, month to month and a half of COVID increases in our community. So just want to thank everybody for their time on that.
Yes.
And I do have a few slides, some data to share if you're interested. Just a couple, quick high level kind of looks at kind of what our experience has been this week, and just a little bit more information. So,
okay. I think it might make sense to start with Jen Murphy, and then if there are questions for her, and then throw it over to you, because I know Jen has been putting together a presentation. She always does a great presentation. So without further ado, Jen, do you want to start us off?
Sure, thank you. Let's see. Can you see my screen?
Yes, I can.
Perfect. So yes, here is a sort of a state of things in Winchester, and a little bit of a snapshot in the state as well, of what we've been experiencing over the past several weeks. Things have certainly taken off since mid-December, roughly, and it's been quite a challenging time for the town, actually. So let me start by just giving you a snapshot of some data and what we're experiencing, not only in Winchester, but obviously all over the state. Right now, about over 80% of our cases that are identified and tested in a laboratory have been identified as Omicron. That's an estimate, but we're certainly seeing it play out in our community because Omicron is highly transmissible. We're seeing far more infections than we've ever seen throughout the course of this 2 years. And so we're having a lot more people become infected. It's very easily to acquire. It appears to be mild infection, which is the good news, especially if you're vaccinated. That's the key thing. If you're vaccinated, and even if you're boosted, it will provide even greater protection. You'll be able to essentially neutralize the virus a lot faster. And so the immunocompromised and the unvaccinated are more prone to severe illness, hospitalizations, and death. And we're seeing that while our data in Massachusetts and Winchester is obviously a smaller set of data than across the state. That piece of information is key that we are seeing here in town, that if you are not vaccinated, you are immunocompromised, you are definitely prone to experiencing more severe illness, hospitalizations, and death. So I just want to express the point that we are in fact seeing that play out in Winchester. And when I say milder infection, obviously there's a range of what people can experience, but in general, vaccinated people are experiencing sore throat, runny nose, and a bad headache overall. Those are the symptoms that are being reported to us. And please note that Delta is still circulating as of now, and Delta is still in and of itself something to contend with, again, if you're unvaccinated or you're immunocompromised. So what does our data look like in town? You can see, this is obviously a trend line over time, and you can see right here at the end for December, our total case count of official positive PCR tests skyrocketed. We saw 480 cases. That's the highest that we had reported to us, as you can see, throughout. So it has put a significant stress, not only I think on the community, but has put a stress on our resources in how we rise to this challenge. And you'll see on the dashboard now, this is how we're reporting positive cases. This includes PCR and antigen, not take-home self-antigen tests. It's solely all of those cases that are officially reported through from the state to us at the health department. So you'll see for the week of December 19th, we had in that 1 week alone 240 cases. And I can tell you that since Sunday, we have already had 234 cases. So again, Omicron, incredibly infectious, impacting a great number of people in our community and the state. And so we all need to do what we can to try to remain safe and limit spread to the extent that we can. This is a slide that just breaks out the data by age. The orange, the orange bars here do tell you exactly the raw case count for each age group. And then the gray line will tell you the percentage of those cases amongst that particular age group. So while, for example, 16 to 19-year-olds accounted for 52 cases, they within that age group, those 52 cases accounted to 4% of that particular age group. So if you look at the percentage gray line there, it will tell you that 12 to 29-year-olds, you definitely are seeing a higher percentage of that age group become infected. What does our positivity rate look like? This was just updated today. You'll see Winchester's in the orange bar. 8.78% of people are tested positive. This is a rolling 2-week period. You can see at the top there. It was December 19th to January 1st. The state positivity rate during that same time frame was a little over 15%. So while we are under the state's positivity rate, it certainly is the highest positivity rate we've ever experienced to date. But again, I want to reiterate, there's a lot of context around this data. And again, we have a very well vaccinated community, which is fabulous. We are doing our best to booster the community, and I think people are taking advantage of that opportunity where they can. So again, this infection is mostly breakthrough that we're seeing. And again, on the whole, it is more mild infection than what we've seen in the past when the original coronavirus came out, to the Delta, to the Omicron we're experiencing now. And this just gives you a trend line over time of our positivity rate. And again, it just really highlights what we're seeing for spread in the community, what we're seeing for positive cases in the community. So it's a very, again, it seems like it's a very stark percentage when you're looking at it like this. And again, you have to remember the context around it. And I didn't no way want to minimize what is occurring, because our mission in public health is to obviously control communicable disease, and we will continue to do that to the extent that we absolutely can, and try to keep this town as safe as we can. And I hope people out there are doing the same and taking this seriously, because the goal is to really try to limit illness. It's great we're experiencing more mild illness as a vaccinated community, but again, we all need to be vigilant to try to limit illness in general. We still have populations that are getting hit harder, and that would be obviously the elderly who are more immunocompromised. They're likely to experience more severe illness, and those who are unvaccinated. And that's in fact what we are seeing. So I just wanted to give you a little snapshot about what the state dashboard is saying about hospitalizations, because I think this is so important that we as individuals and collectively as a town and a state try to help mitigate the incredible impact that the hospitals are facing right now. This is the 7-day average of hospitalizations due to COVID. And obviously that trend line is going up. So deaths are, as you're seeing, usually there's a greater lag time from hospitalizations to deaths. But again, this is just giving you a snapshot of what is going on over the past 7 days. And again, the context is that while what the hospitals are experiencing is not good, it's quite challenging for them, actually, as we all know and have heard, there's more widespread infection. This would be the expectation of what we would see, given that there's more infectious people out there. So again, it's not to minimize that. I think we all, again, personally, collectively need to do what we can to try to, help the situation in our emergency rooms and our ICU for sure. But I think that there's always context around this data, and I want to go to, let's see, the next slide. So again, I think we heard from the president of Winchester Hospital right before Christmas, who really sort of implored the Board of Health to assist with limiting the spread of illness. So to the extent that we can do that, we should continue to do that. A little bit of I don't want to say good news, but it really is kudos to our community. Our vaccination rates are very good. And this data reflects the first and second dose. So that's considered really a fully vaccinated person. I know that there's different definitions going on right now at the federal and the state level, but for purposes of this slide, this reflects a 2-dose series or a 1 dose of J&J. We don't have booster data as of yet produced by the state, but we hope to have that soon. So as you can see, most of our age categories have incredible vaccination rates. 5 to 11-year-olds definitely caught up. I think the last time I reported out, we were about half that. So now we're up to 65% in that age group. So that is very good news, and we will work to continue to get boosters out there. 16 and older are eligible, and very soon to be 12 to 15-year-olds will be as well. So that's who's vaccinated. Now, in terms of breakthrough, who's getting sick, or what does that data look like about breakthrough infection? So of the cases in Massachusetts, 3.5% are breakthrough cases, right? So again, we're seeing a lot more cases in general. The number of breakthrough cases is obviously rising as well. The sort of good news is that although we are having a surge at our hospitals, if you look at of the breakthrough cases, the hospitalizations and deaths are remaining below 1% of the breakthrough cases. So it's showing you the efficacy, it's demonstrating the efficacy of our vaccines that still should be one of our main mitigation strategies. Now, Frank, I had some data here on school. Did you want me to put them up? Do you want to use your own slides? What would you, or I can continue mine and then we can flip to you.
Perfect.
Okay.
I like the colors of your slide. It's soothing, so mine are just kind of stark.
You're welcome to use mine if you like. That's fine. So what have we been doing in terms of mitigation strategies? Well, the mask mandate, as we all know, is reinstated. That's a good thing, right? We have that in all indoor public spaces as a requirement now in town. The health department has been doing, excuse me, case investigation and contact tracing in close collaboration with the schools, especially now since we've resumed after the break and we're seeing obviously, there's more cases in the community, and that rise in infection was brought, into the schools. They're not exempt from that, unfortunately. So we've been working around the clock since over vacation, over break, trying to go through the new guidance for contact tracing, which has changed a bit and can seem somewhat confusing, admittedly, and we hope to take more measures to help educate the public on that. But honestly, it's most of our efforts over the past week and so has been really dedicated to trying to keep the schools as safe as possible. We've been offering booster clinics and we hope to continue to do that. Excuse me. We've expanded our PCR testing clinics at Town Hall. There's been great demand for that this week we're in rather. We have had 2 clinics. We added one last week over the break. And thank you very much to all the folks on my team who work on standing up those testing clinics as we see a need and a demand. They've been fabulous at standing up very quickly the more clinics and adding more appointments. This past Monday, we had close to 400, I think we had 370 people attend. The clinic for tomorrow, the testing clinic, is actually about at the same capacity. So the demand is there and we want to continue doing that as well. We did have a booster clinic today, I just want to add as well. And that was open to anyone 16 plus. And we were trying to get the hours, so it was a little bit of after school. So hopefully some high school students took advantage of that. So we've taken all those measures so far that we want to continue to do. In terms of our risk communication and messaging, we have been updating our website and trying to direct people there as the messages have changed. We've also been promoting or sending out our digital dose series. Hopefully people have looked at that through Twitter and the town's Facebook page. And we have seen some banners around town. We hope to do more of that messaging as well, really encouraging people to be safe and how to be safe and take personal responsibility. That's the new sort of slogan. And I'll touch on that in 1 minute. And so all of that will continue and ramp up quite a bit as well. There's a lot more risk communication, more education around the updated guidance that we really need to do. And we look forward to doing that as well. We want to hold a live webinar event as we did several months ago, right after after school opened. So hopefully between myself, the school nurse leader, and anyone else who would like to come and host this and answer questions, I think it'll be a worthwhile event that we hope to do within the next week or so. This is the banner you've seen. It's at the transfer station. It's near the Jenks parking lot, really just reminding people to test. It's one of the best mitigation tools that we have. Know what your health status is before you meet with people, especially if you're experiencing symptoms. Test, get an official test, a PCR test at Town Hall, but also, take advantage of home testing where you can. And I know this community has been taking advantage of it based on all of the reporting that we've been receiving through the schools as well as through my office. So the next phase, as a directive from the governor and DPH, we're shifting to really a personal responsibility strategy. Unfortunately, I think with the advent of Omicron, it was just very poor timing. to be doing this, because it really places right now a lot of the burden for managing illness and managing your exposure on the individual people. And so I think there's a lot more education that can be done around that we hope to do. But again, we're transitioning to this. So you'll notice that, for example, you know, the health department won't be calling close contacts. We had to scale back on the contact tracing that we're doing. That was a mandate from the state to do that, because we really need to focus on, you know, K through 12, daycares, long-term care, nursing homes, and large clusters. So we really shifted our focus to those types of settings. And it's been, even just doing that has been challenging. But this is the way that things are going. We're not quite there to treating COVID, obviously, like the flu, but that was the hope that we would, you know, try to transition to that model at some point. But there's bumps in the roads, and definitely with the Omicron surge that we're seeing right now, it has been challenging. Right now, you'll see on our website, we did update our isolation and quarantine guidance, and we're asking positive people to notify their close contacts. Now, the school has completely different set of requirements and what to do if you're positive as a student and returning to school. But, you know, it's, as I said, I hope that we can do a joint webinar in the future so that we can fully explain and answer questions to the school community regarding that. And so that's what I have for data. Frank, I'm happy to use my school slides or.
Sure. I have, like I said, I just have a few slides I thought would be, might be interesting, just a couple snapshots as by way of just giving you some sense of what we're seeing and the kind of the challenges we're facing. If you could just let me know when you can see it.
I can see it.
Okay, I can't see y'all, so so just a couple things. One is, as you know, the state had come out in the middle of last week and announced that we were going to be getting some KN95 masks. They had purchased, I believe they had acquired over 6 million to be distributed across the state. Again, this was during the December break, which presented some challenges in terms of picking up and figuring out distribution. And then they also announced that they were going to be providing 2 tests per staff member also to be picked up this past week. And the pickup dates for the tests were either New Year's Day or the Sunday following. So I just really want to start by saying, just giving a huge thanks to Pete Lawson, to the DPW for arranging to go make those pickups and bring those supplies back to us. We were able to stand up fairly quickly a drive-through pickup for staff on Sunday. We had about 35% of our staff participate in that. And then Monday, the additional tests were available within the school. The number of tests that were provided were actually half of what the DESE had said that they were going to be able to provide. So we really effectively got 1 test per staff member. And then we received notice today too around, there have been some concerns about the KN95 masks that were provided, that they in fact may not be effectively KN95 from the perspective of how efficient they were. So there was quite a bit of back and forth, and the department released information a little bit yesterday, but made kind of a formal announcement today that the masks that were provided, they were both medical KN95s and non-medical. And the medical ones had been tested by MIT and rated around 87%. The non-medical ones did not rate as well. Actually, the non-medical ones were not rated at all. So we sent out today a notice to all of our staff just to let them know that information. We have had some staff who have taken advantage of them. They have been distributed, obviously voluntary as to whether they wear them or not. I also want to clarify that there was no state testing requirement for staff to reopen on Monday. The announcement of the tests that were going to be provided was really quite out of the blue during the vacation week. But the department was clear that it wasn't a litmus test as to whether or not staff could come back. Obviously, it would have been great to have had those prior to vacation or during the vacation week when we could have planned it out a little bit more. So I know that obviously, well, some school systems made some decisions about Monday and whether or not they brought their staff back. We felt pretty strongly that there was, in talking to Jen Murphy and internally, administratively, felt strongly that there was no real advantage to not coming back, given the fact that we were the New Year's Day was on Saturday, and we felt that testing, what was most important was to provide as much testing as we could over the course of this week for students in particular, but also staff because we also know that the test's going to show different things depending on the day that staff takes it. We also did not have a sense, honestly, about who was coming back, who wasn't coming back. So in a lot of ways, we needed to have the day to kind of inventory and just look at what our situation was. So to our absence rate or absences over the course of this week, on Monday, you can see that we had 628 total absences. I want to make sure that I'm clear that not all of these are COVID related. There are some students who are sick, some students who did not return from vacation. So even though the number is certainly higher than what we would normally experience, these are not effectively, these are not COVID positive students. And I'll just give you as an example, roughly 217 of the students at the high school on Monday, or the 236, roughly about 50% of those students we've identified as COVID positive. So the attendance rates the absence rates are fairly high. We do have some families deciding to keep students out because they are concerned about transmission of the virus. So there are various reasons as to why those numbers are as high as they are. However, I think interestingly, you can see from Monday to today, we saw a decent drop in the number of students who are absent. What is really causing us both concern and challenges are the number of absences at both McCall and the high school. As you can see, both of those schools went up from Monday to today, not substantially, but enough to cause additional concerns about just how what kind of condition our students are both in and when they will return in terms of, and also in terms of their learning. But you can see across the board at the elementary schools, we did see some drop other than the preschool. And just as a reminder, preschool students obviously do not qualify for the vaccine at this point. We do have a dashboard thanks to the efforts of the town health department. This gets updated fairly regularly. This was actually updated as of today. And you can see we certainly are experiencing higher active cases than we have in quite some time. And this shows you the actual number of positive cases that we are seeing as of right now. So that information is available. We have pretty good traffic on that site. I just want to show you, this is pulled as of today. And these data can lag. So depending on what data source you're looking at, the rates can look different, but these are the actual, as we have them right now in our system, the vaccination percentage of students who are vaccinated by school. You can see that we do have some discrepancies between our schools, which we need to, I think, as a community, as health department and school department, focus on and trying to get more of our students vaccinated across the board. But we do have a decent, considering that we're talking 5 to 11-year-olds in this category, given the fact that the vaccine has not been available for a tremendous amount of time for that age range. We do have a decent vaccination rate of 71.64% overall. And then at the high school, middle school and the high school, you can see that our vaccination rates are pretty high, and we have students who are starting to get into the booster dose, which is good to see. We need to continue to push that. But the high school right now is at almost 91% vaccinated. So clearly a huge step for us in the health of our kids in our community. just quickly, and I'm not going to read through this, but we sent a message out and have continued to message and have on our website the different mitigation strategies that we have been and are continuing to use. We have had in Winchester focused last year smartly on ventilation and spent a lot of time, DPW Facilities Department spent a lot of time really making sure that the air exchange systems were working to their capacity, and that we have implemented HEPA air filtration units in the majority of our buildings, depending on the readings that we were getting for ventilation and air exchange. And we continue to distance as best we can, both within the classroom and at lunchtime. We feel pretty strongly and have from the beginning that it is obviously when kids take their masks off when we have they are most vulnerable for transmission. There are a lot of school systems around us that aren't using other spaces to distance students at lunchtime. We have done that since last year. We continue to do it all this year, and plan to continue to do it as well. But we are also obviously involved with the surveillance testing and test and stay. And those are the two areas that we have spent a lot of time talking to Jen Murphy and Beth and Mark about how can we really try to ramp this up as much as we can. Students to this point have had to give their consent for us to have them participate in the surveillance or pool testing, as well as the test and stay program. And I just want to point out that test and stay is a program for students who are non-vaccinated. So if you are a close contact and you are non-vaccinated as a student, you participate in test and stay, you test essentially 5 days in a row, and you can stay in school as long as you're negative. But if you are vaccinated, you are not eligible for test and stay. You are not considered a close contact under DESE's definition for in school. So as we approach, again, we're over 90% vaccinated at the high school. We're talking about 10% of our population at the high school right now that would even qualify for test and stay. It's a great program, but it is a heavy lift. And going back to Jen's earlier comments about contact tracing, what we are really pressed with this week, and we have several of our nurses who are actually out. What we're really pressed with this week right now is keeping up with contact tracing. And we've talked a lot about actually expanding communication related to contact tracing, which would look like us potentially notifying families of a positive case within a classroom. We've stayed away from that up to this point because the infection rates were lower, and we were really concerned, obviously, about student confidentiality. But because of the number of transmissions that we're dealing with right now, or the number of cases that we're seeing, it may make sense for us to shift our strategy a little bit. That's also a conversation that's happening within the Middlesex superintendent's group. So with that, I will stop and turn it back over.
Can I just say sorry, do you mind if I just add on?
Go ahead.
One thing, thank you. And Frank, thank you very much for all of that. I think it's important to say just a couple of things because the schools are proving to be a little just challenging, right? And so it is incumbent upon the parent community to please, if your child is exhibiting any symptoms, and again, Omicron seems to be developing as more cold-like symptoms, sore throat, headache, runny nose. Runny nose is a commonality we hear throughout, right? So please don't underestimate any of these symptoms and think that they're a cold or allergies. Please get a home test. Please attend one of our PCR clinics at Town Hall, but please don't send your child to school sick. That would be a big help because in fact, if they are in fact positive, it's just going to continue the potential spread, right? So that's a big thing that parents can do is screen your child every day before you send them to school, please. And also, the testing programs that are offered at the school, they are free, but parents have to opt in. You actually have to go and sign your child up to do it. So please, I encourage you, the weekly COVID safety checks, as they're called, are done right at school. In the high school, you're given a kit to take home. Anyway, it's relatively easy lift to do, right? And that would be a fabulous way to check in on every child's health. Right now, we only have a 5% enrollment at the high school. We need to do better as a community and opting your child into and taking advantage of all of the testing, free testing that is available, the weekly safety checks, the test and stay. Please sign your child up. That would be a big help, as well as to the general public. If I can just say, I realize you're all trying to manage perhaps your result that you got as a positive individual. Again, staying home if you're symptomatic, staying home if you've received a positive result on your home test. Home tests are ubiquitous. Many, many people are doing them, and that's great. And you're getting that information. You just need to remember to act on that information and make sure that you stay home. Right now, the guidance is to stay home for 5 days, but I can tell you, if you still have symptoms, you should be staying in your house longer. Absolutely. So please be mindful of those things. We are going through a surge. It will be temporary. And I think if we can all just, keep this in mind, keep track of your own safety, your own health. The burden is on the community in large part now, and you have the tools to get your health status. Are you positive? Are you negative? You have and other means to stay safe as well, with masking and so forth. So I implore you to take advantage of all of those things. Thank you.
Well, thank you both. I would like to open it up to questions, and if I may, before I forget, because I find if I don't ask my question, I forget. If I could start, you talked about some of the nurses being out. I'm just wondering how the teachers are doing, and what if if there's an absence rate, or if you're concerned, or how they're handling it.
They're handling it extraordinarily well, and we're certainly proud of all of them and thankful for their efforts. But I can tell you, it isn't easy. I don't think the general public completely understands the work, the effort, the concern that some of our staff have for not only their own health, but for the health of their own families, for the health of the students that they have in front of them. So, we do take these mitigation steps seriously. But when you walk into a school, there is good learning going on. I would say over the course of this year alone, other than students wearing masks, you wouldn't necessarily even know that anything was different. Teachers are engaged with kids are engaged in their learning, and they're handling it like the professionals that they are. So we're grateful and thankful to have the staff that we have. In terms of our ability to staff, we're doing okay, but we're covering, it is sometimes a little bit of a mad scramble, and we are pulling it together. And in the morning of school starting, we've have principals covering classrooms and doing everything we can to make sure that we keep our students in school and keep them in a learning environment the best we can. The middle school is causing us some challenges. We do have quite a few staff that are out that are COVID positive, so that's been a little bit of a heavier lift. But there's a little bit more flexibility with middle school students in terms of being able to bring them together in a larger space for supervisory purposes. I think we absolutely made the right decision to come back full time on Monday. I think I am hopeful that and believe that, to date, unless something changes dramatically, that we're going to continue to see this wave, but I'm kind of hoping the wave ripples through in a way that's manageable and allows us to continue to staff. To any parents who are out there, any community members, if you are looking for something to do, you can sign up to be a substitute teacher in the Winchester Public Schools. We'd love to have you. Because we are obviously looking for people all the time right now. We are still having some staffing challenges like every other school system in the state. We have some issues with transportation bus drivers who are COVID positive, and we've had some impact on our transportation routes as well. But the more difficult positions we have to hire are proving difficult, and we're not alone in that. But the staff they're doing all right. They're doing a great job.
Yeah, no, I know they're professionals and they're doing their job. And the kids seem to get it about the masks, They've just gotten used to it. It's an important thing to do, to
Yeah,
protect
and I
each
would
other.
I would just say, you know, I've received emails in the fall, and I think we've all probably heard, and maybe some of you. I mean, you know, masking has been in some places controversial. Masking has been, there are people who feel strongly about whether or not we should be the effectiveness of it. I can just tell you that for us, it is the number one mitigation strategy that we have in place. And you know, I'm not a scientist, but I can tell you that the transmission rate in the schools that we can really confirm is extremely low. So when students are with us, and even though they're together and they are masked and they are following the mitigation strategies that we have in place, it's probably the safest part of their entire day.
Okay. So Mariano, you have your hand up. Go ahead.
Yeah, thank you, Susan. Yeah, so my question is about vaccinations, and on January 15th, the city of Boston and other towns and cities around us are going to start requiring proof of vaccination for certain indoor spaces, restaurants, gyms. And I was wondering what would be the process for us to join the other towns and cities around us to be consistent with them. And we know that vaccination is the number one way to prevent spread and especially to prevent hospitalization and death. And also know that many residents are hesitant to go to businesses that don't require proof of vaccination to enter. So I think joining Boston and others would help both in preventing the spread, preventing negative outcomes, and definitely helping our businesses as people would feel more comfortable in being able to go to our local businesses. So what's the process, and are we looking at joining that on January 15th?
So I think Beth and Jen, to some extent, have been looking into that. And as I understand it, we're going to need some more guidance from town council on how to, whether we can do that as a town and how we would. I'm interested in doing that as well. I agree with you. Beth, do you have anything to add on the whole vaccination passport idea?
I don't. We've just had some very
Yeah.
preliminary conversations with council, sort of focused around the process and who would be the entity that would implement such a requirement.
Okay.
So I'm certainly curious to see. I know it's been discussed in Arlington and Brookline. I'm curious to see how other communities have done that. So happy to reach out to those communities as well to get some more information.
Okay. Okay. Mike, I think you're next. Mike.
Thanks, Susan, and thank you, Dr. Hackett and Jen, Beth, and Kathy as well. I know everybody's got a lot of meetings, and it's a busy time, so appreciate you coming here to give us an update on what's been going on. One of the questions I had is we're kind of, I know there's a plan and some recommendations and requests coming before us, which I appreciate those being pulled together. And one of the things is just what metrics are we kind of identifying that we'll be using, in the coming months to make decisions on the passports and the mask mandates as things kind of shift with the variants. I think it's helpful for us if we say, hey, we have a high positivity rate but low hospitalization. So that triggers a different set of activities for us and tactics for us and strategies for us to take. And I think that is just helpful. I think that the presentation, Jen, that you put together was really helpful, but at the same time, I think everybody's kind of using different information and it creates a lot of confusion, at least on our end too. So, and I'm sure that it's a moving target a little bit, but when pre-vaccine, we had a different strategy, and now high vaccination rate and high positivity rate and maybe different levels of hospitalization. And I was actually pretty surprised to see that there was such a high presence of Omicron, but a low level of Delta. I don't know if that's what we expect to see in coming months as well, as these variants keep showing up and fading in and fading out. So I guess my question is, are we establishing a set of metrics to kind of communicate to the public about where we stand at different points in time? So when we have a mask mandate in place, people understand that it's for a real reason, or if we have a passport in place, it's for a reason.
Kathy, did you want to chime in? That sounds like, a Board of Health type of discussion as well. But Mike, I can tell you that we have not had dialogue about that type of metric, but if that may be a good suggestion. Kathy, did you want to weigh in on that? Or you're muted.
Yeah, you're muted.
Yeah, I would agree with that as well. And so I think currently how the order is written for the next meeting is basically to reassess the situation, which is not enough. As we're talking about, we need to have some hardcore data to work off of. So between now and then, I know we have planned discussions and looking at what other communities are doing as it relates to this, and trying to figure out what is the best benchmark. A lot of people have a lot of different thoughts on this. And so we're very open to your thoughts of what you might think would be the best benchmark. But like I said, we're also looking to other communities and seeing what they're doing, and then plan on presenting that at our next meeting.
Rich, you have your hand up.
Thanks, Susan. I have multiple questions, if that's okay. I appreciate everyone joining us tonight. Dr. Hackett, first to you. Thank you for all your hard work over vacation and getting the schools up and running on Monday, and to the staff, the administrators, and the teachers. It's been quite a challenge. I hear anecdotally from my wife, who's a 4th grade teacher in a different district, how challenging these last 3 days have been. So I have a little sense of what's going on, and it's incredible work. And it seems to be that, every curveball that's thrown, the schools rise to the occasion. So thank you for that. And to Jen, to your staff and everyone working hard behind the scenes, thinking that we were turning the corner and then, being slapped in the face with this new variant, thank you for all your hard work. I did listen to the presentation. I guess I'm a little confused a little bit on the numbers, and frankly, I'm not sure the numbers of cases truly matter at this point, because of so many people home testing. Dr. Hackett reported that half the absences today at the high school were attributed to COVID. You're reporting 230 cases since Sunday. So it sounds like, the numbers that are out there, are starting to become a little bit of a guesstimate. I know you've asked people to report cases, if they test at home, but they seem to be rising, and they're probably above what we're actually reporting on that dashboard. Is that fair to say?
Yes, we are, because we're relying upon people to, at least for the schools, to self-report, right, through the Google form that was created prior to the start of school. So it's as good as parents report into the school system.
Right. So it sounds like, obviously we have a rapidly developing situation here in Winchester and to the state as well. So I guess what, I've heard, the where we've been and the statistics. I guess my question for you, Jen, and Dr. Hackett, if you think anything applies to the school, is what is our action plan for the next 2 to 3 weeks? Because, ultimately this is probably a shorter surge than we're used to. And I think the next 2 to 3 weeks are critical. And I think that's what the community is looking to hear. What are we going to do for booster clinics? What do we have planned for the next week, 2 weeks? How are we going to get into the schools to get, at least those 16-year-olds, vaccinated? The next wave of elementary students vaccinated, increasing our PCR testing in town. Are we going to make home testing kits available? And then ultimately communication. Jen, I think you had a very strong message tonight, but as I'm looking at the attendees on this call, there's 27 people at least on the Zoom, probably more watching at home. How are we getting that messaging out? And are we relying on, possibly our collaborative with the Mystic Valley collaborative to help with communication or elsewhere? So I guess I'll turn it over to you, and just, if you could, just walk us through what you see the action plan is. If you want to do the next 2 weeks, next week, just, what you see happening.
Yep, sure. Thank you for that segue. Beth, can you put up that ARPA request letter, please? Because that sort of lays out how we envision the next coming weeks. So this ties into the funding request, Rich. Really, it's important to say though that, we all have the tools that to stay safe. And so we're going to just essentially supplement and ramp up what we are already doing. So let's see, for COVID testing, there are two-prong approach. One is to ramp up testing to twice weekly, more if we needed it. Obviously, if we need to target a particular population, let's say we need to test everyone in a particular classroom or something, we can obviously stand up the PCR testing at town hall to do that. Whoops, sorry. So the twice weekly PCR testing at town hall. And we want to make that free of charge throughout the month of January. And so that will be a given, and we will open up those registration links as soon as we, as soon as 1 week is done, we'll open up for the next week. And then also the purchase of home testing kits, because I think it's a good tool. It's a really good tool for people to be able to check in with their health at home. And so, the target audience or the target recipients for that would be, we would want to start with those in most need in our community. And we have a way to basically figure that out to get a good estimate of that. We also want to take into account others in the population, for example, employees throughout the community, the schools, as well as the town employees, but also in the general population to be able to hand them out to people as well. So that's the initial purchase we're going to make, and I've been talking with the town manager about this, Beth, is for a little over 15,000 home test kits. There are 2 tests in each kit. And then once those are required, we'll distribute them to the priority populations that I just mentioned. So those are two strategies for COVID testing. We also want to ramp up our case outreach, and I'm calling it case outreach versus contact tracing because, again, the traditional version of contact tracing has sort of scaled back in some respects due to the advent of home testing. People are really have to take responsibility for themselves, but we obviously still have a big role, right, with the schools and so forth, and targeting congregate settings. But it's evident we need between the schools and we need more staff to do that. One thing that's become an apparent need is a communication mechanism for answering questions for people who test positive on their home tests, for example, understanding the new guidance, when can they re-enter society after isolation, those types of questions from the school side and from the general public. So we hope to stand up a COVID call line. We're actually working on this. Beth is helping us work on this to get this done right away. And so that would hopefully be available for, a date to be determined. And then obviously we want to look at other things. We're going to continue with our risk communication piece. We're going to continue with our mask mandate education / compliance piece of things. We obviously have very good compliance in town. When you walk around town into different retailers, I do notice very good compliance. Obviously, this will be a targeted approach for enforcement of this. We are going to do a mailing to all businesses, including free signage that they can hang, but also informing them of the order that people mask up in an indoor setting. We'll do a mass mailing to all retailers in town, but also have a targeted approach to complaints that come in and involve other town officials, for example, the police on a as needed basis. And then we want to also purchase more supplies for masks and so forth, so that if we do have to walk around town and do mask enforcement, we're obviously handing out masks to businesses to make their job a little bit easier and communicating to the public and offering up those supplies. So really, we need to focus on testing as a mitigation strategy, and that includes on the school side as well. Again, parents taking advantage of that testing on the school end of things as well. But also I feel like the communication and case outreach, because we're having so much home testing, that I feel like the information that is given to people, even on an individual basis, is still so important, because people don't know how to transition and what to do with this information. We used to be able to have phone calls with everyone, and we would say, no, you need to isolate from this date to this date, but then check back in with them repeatedly to let them know when it was truly safe based on their symptoms and infectious period to re-enter, sort of, well, to leave their house essentially. So those conversations obviously are scaled back greatly. And so I feel like this call line will go a long way, though, in trying to supplant that. So this is a snapshot of what we're doing. I also mentioned the webinar will happen hopefully next week. So that'll be sort of direct communication with the public around isolation, specifically isolation and quarantine guidance as well. Because I feel like there's a lot of education we need to do around that theme right now. We also intend to hold up booster clinics, and that's sort of a footnote at the bottom of this memo, because initially we thought that FEMA would fund all of our vaccine clinics. And it looks like that either will end or is not possible anymore. So that if that is not the case, I will come back and ask for more funding, because we are absolutely going to hold up more booster clinics to the extent that we can. Again, we had two in December, right before the holiday break. We had one today. Obviously, with the advent of the age group 12 to 15 coming online fairly soon, we want to get other clinics set up. Right now, we have January 24th, January 31st for the Jenks Center specifically. And if the age group 12 plus is eligible at that time, which they should be, those clinics will be open to 12 plus at the Jenks Center at those 2 dates at the end of January. I will, to the best of my ability, try to hold a clinic between now and January 24th, but right now that's what I have on the books. And obviously that effort will continue after January, but that's what I have so far for the month.
And do we have those multiple days of PCR testing set up for next week, Jen? The 2 days of next week?
I believe we do. I believe that should be on the website. I know the dates are reserved. Whether or not the links are live yet, I don't know. Let me, while you're talking amongst yourselves, let me look.
So the community can expect, 2 PCR testing clinics from the town next week, a booster clinic at least on January 24th and 31st, and possibly if you can do one beforehand, you would do that as well. And in terms of the home test purchasing, if the money was authorized, is there any sense of when those would arrive and be available to the public?
Beth, do you have information? I think Pete Lawson of the DPW, I believe, is trying to figure that out right now. Beth, do you have any more?
I want to say it's like a week or two. It's not, obviously we're not going to get them here by Friday to start handing out to people, unfortunately, which I think is what we all would hope would be the case. But so yeah, I don't have an exact date, but I think it's a week to 2 week timeline for those to be received.
I had a chance to talk to Pete today, just not too long ago. He was working on a couple different vendors. So just, I think, trying to find the right test with the right price point with the right delivery date is kind of the key. I would just want to add, Rich, if I might, that this, and partly going back to Mike's question about metrics, I want to first of all say, because I've been asked the question, what's the metric when we go virtual? There is no metric that we go virtual. Virtual is not an option, period. So the department is very clear that school departments cannot go remote learning, full remote learning. We are taking that to heart. So the answer to is there a metric that we would make that decision? It would be, we would have to be in a situation where we would have to shut down a school for whatever reason, the staffing or the rates are so high. And then it would have to be a long-term closure. And then we would have to talk to the Department of Elementary Education about whether or not we could do something remotely. And then it may not apply to the entire school district. So the number of steps in that process really makes it so that I don't anticipate, unless something changes dramatically, and I shouldn't say that given what we've learned over the last couple of years, that I don't see a scenario where we would go remote. I also just want to say that we get asked the question about masking. And like I said at the onset of this, we would not be in school this week if we weren't masked. There's just no question in my mind. This variant is very different, as we know, than the ones we've seen come before this. And what I worry about is that there likely will be another variant that might have a whole different set of characteristics and qualities. And if I have a criticism of the Department of Education, I feel like they have not done a good job learning from what we've been through. And to lay down these absolutes and develop metrics and say, if we hit this, this is exactly what we're going to do, has proven to be somewhat folly, because it has just changed so much. I think our challenge is to make sure that we're nimble enough, agile enough to be able to change with it. In this particular situation, we're seeing so much positivity that I really feel like the strategy of testing is the most important. If I was king of the world, it would be awesome in so many ways, but in one way it would be particularly awesome is that we would be testing kids and staff as much as we could. I mean, I think we test our way out of these next few weeks because we need to do, the one thing we need to do is make sure that we keep kids and staff who are positive out of our buildings. That is now the goal. We are now the goalie trying to keep people out who are positive. It's not as much now about, are you a close contact? And then what do we do with you in quarantine and test and stay? It is very much now about keeping positive cases out of our buildings. And the only way we're going to know that is to test. So the extent that we can test more within the community, the extent that we can test more in the school setting, get kids to sign up for testing, find ways to incentivize that, which we've really worked hard on. It is a challenge at the high school and we're not alone with that, but I really do think that that is the short-term strategy to get us through this particular bump that we're hitting right now.
Okay, thank you, Frank. In a way, what I'm hearing is that this idea that there are metrics and there are sort of overall plans, all hybrid or all remote or in school, create some false expectations about certainty, and that this is a situation where there's very little certainty, or the certainty does not last very long. And as you said, it's about being nimble and responding to things as they change. Mike, I think you had your hand up.
Thanks, Susan. Just a general question about the efficacy of the home tests. I know there's been some talk about them not picking up the Omicron, as easily as picked up the other variants. Is that a problem? Are there different testing kits? I know that we're investing in quite a few, and we certainly should. I didn't know if there's been any discussion at the state level, other peer communities about that.
So that question was asked on a DPH conference call this week. Should we be looking at the details of the three manufacturers that were offered up through the combis, the state contract system, in regards to sensitivity, specificity, how much should we be digging into that data? And they said, you can order any one. They are all just as effective. Now, just as effective at your question to Omicron, I don't know. That wasn't specifically asked, but they encouraged us, and I'm not sure they would lead us down a road that would be, end up in greater issues. They did encourage us to buy from any of the three manufacturers, actually. I mean, here's the overall take on antigen tests. If you're symptomatic and it's a positive home test result that you get, you can rely on that. If you're symptomatic and it's negative, I strongly encourage you to go get a PCR test. I would question it. So that's the general rule. But in terms of your Omicron question, they did not speak to that specifically, as that would be an issue.
So, Jen, you were going to show us something, or?
Sorry, yeah, I think I did that prematurely. Sorry.
Oh, okay.
This was for the testing. Rich, you asked about additional dates. We do have them noted. We don't have the links live yet, only because sometimes people, cancel out or, make appointments and then don't forget to cancel, so because they forget about it. So in any event, it'll be next Monday and next Wednesday at Town Hall, and those are the times there. And the links will go live towards the end of the week.
Jen, what does it cost the town to put on one of these clinics? For testing?
So the actual test, the analysis for the actual test, including supplies, is $28.50. Then we have costs for medical staff to oversee the event and to oversee the self-swabbing or swab when people cannot otherwise do it themselves. And then we have clerical help. The clerical help has largely been an in-kind thing. In other words, we have someone who's already working in town hall, clerk the activity, clerk the clinic.
So one of the things we mentioned was we're looking at absorbing the cost of those clinics for the rest of January and making those free for everybody. So that's part of the additional funding request that's being asked for tonight. Sorry, Rich.
No, I was just going to say, is it something that it's a $20 fee per test. I don't think that's breaking the bank for anyone. Is it something that if we didn't make it free, we could offer more frequently rather than having 2 a week? Maybe we could go to 3, Monday, Wednesday, Friday, or Monday, Wednesday, Saturday, or something like that. I don't know. Do we have the capabilities of doing that?
It's possible. It's really a staffing issue, Rich. We have to make sure we have we need at least one medical supervisor on site for the whole event. It could be an EMT, it could be a nurse, it really runs a gamut of what that medical credential can be. It's oftentimes, people have been very good about coming and working them, but also our testing sort of coordinator, she's the one who oversees the entire event. So if something goes sideways, like our label maker stops working, or our computer goes down, or Wi-Fi goes down, she's the one who actually will troubleshoot, and she's very good at it. So we will try to do that. If you would like to see that, I think I heard you say 3 times a week is something you would like to see through January.
Yeah, I think more is better. I've heard, people waiting in 2-hour lines, 3-hour lines with small children because it's really hard to get tests or waiting. I know the program, you get a pretty good response back typically. And I know people have been waiting 4 or 5 days, at some point for lab tests to come back from different providers. So if it's a service we can provide to our residents, even if we need to charge the $20, to do it more often, I think that's something, certainly we should consider doing. Because I think there's obviously a need. They've been full. Sounds like the last 2 have been full. And I would imagine the next couple of weeks would be full. And I think it's a short-term problem at this point.
Okay. Sorry.
Mike, did you have a question?
Yeah, just a quick comment. And to Rich's point, we do have federal funds that we've received for this purpose. So I know everyone has been weighing decisions. Oh, we don't want to use taxpayer funds for doing these, holding these clinics and everything in these testing sites and purchasing of the home testing materials. But we received quite a bit of money from the federal government through ARPA to do this, and it was very targeted for these specific kind of things. So to Rich's point, I think this is now the time to use it and implement this, and to the degree that Jen is able to do it. It is a staffing issue everywhere, and I know it is a lot. I attended both the PCR clinics, and I think that in the past few weeks, and they're very well run. Lines are there, but I think that can be avoided with more staffing, and we will probably see quite a bit more enrollment in those programs if we do waive the fee, or at least moving forward, waive it for seniors, or we don't want to deter people who struggle to provide that fee as well. So thank you.
Right. We could learn something about, whether there's, we get more people if it is free, and if we don't, then, maybe we just focus, shift gears. Mariano, you had a question.
Yeah, thank you. I've heard from a few people who've been deterred from going into the testing because of how crowded it is indoors at town hall. when the testing clinics are going on. So I'm not sure if there's something that we can do about that. And how close, right? And you're going to go get tested for COVID, right? You don't want to be really close to a lot of other people indoors. And the other thing is, I'm concerned about the vaccination rate. Honestly, I'm surprised that 10% of high school students have 0 vaccinations, and also the testing rate. And I'm wondering if there's something that we can do. I don't know if it's a communication. Is it getting lost in the in emails? Is there something that we can do to target, to increase the numbers for both, more concise instructions, or something that we can do from a communication standpoint to get the vaccination rate, not just for high schoolers, middle school, anybody who's eligible. The number that jumped out at me was the high school, since those are the ones who have been eligible to be vaccinated the longest. So I'm surprised that 10% have 0 vaccinations. So I don't know if there's a plan to change that in the near future.
I just from my perspective, it's a great question. And anything we can do to promote is we would be obviously willing to do. I'm a little bit more concerned about the elementary levels and a little bit concerned about the discrepancy between the schools. And I think that could be an access issue that, we I think can have an impact on. And, we'll continue to work with Jen and the health department on maybe some opportunities for us to bring those numbers up. 10% at the high school kind of tells me that's a conscious decision that either kids or families have made to not get vaccinated. That number just kind of holds kind of true, and depending on different looking at different populations. So I don't know, that may not be the case, but it just seems to me that given the fact that high school kids have been eligible for vaccines since last spring, that we may be looking at a number that is probably going to hold pretty firm.
So are we planning on having maybe a vaccine clinic at elementary schools?
We would love to have that conversation. We've been talking a little bit in and around it. It's kind of been all hands on deck the last couple of weeks right now. So we would definitely like to try to coordinate that. The challenge we have also this week is just our own staffing, and introducing one more thing is not something that people are probably going to want to hear from me at this point. So I think timing is the key, or other opportunities that may not be as impactful on our buildings, but yet provide access.
Jen, what are the hurdles for having a vaccine clinic right now? Is it securing the vaccine? Is it staffing? I mean, what do you think the biggest challenges are at this point?
Yeah, it's mostly staffing, quite honestly, only because I have 2 nurses who can be the lead supervisor of every clinic. And that is Kathy Whitaker, our retired nurse who did the 2 before Christmas and the 1 today. And then Karen DeCampo, who is away right now, but will be the one who resumes our booster clinics January 24th. So, the question is, can I get another lead nurse who's well-versed in our software that we have to use, who have done mass public clinics like this, because they're a lot different than a doctor's office for sure. And there's a lot of moving pieces and parts to it. So, to the extent that I can rely on Kathy Whitaker to hold more before she luckily takes off on her well-deserved trip to Florida for the winter, I will do that. I will certainly ask her. She's been wonderful since she's retired in helping us out, actually. But it would be, short of that, it would be training someone to essentially function as the lead nurse for these clinics, or borrowing one from another community, but that's unlikely given how absolutely stretched everyone is.
How about our collaborative? Do we have a possibility of shared nursing services in that Mystic Valley collaborative that we have?
Yeah, that's what I was referring to, borrowing someone from another community. But I think everybody's trying to do the same. But if we were to stand up like a very large Saturday clinic, I would look to a collaborative effort to perhaps do that. Yeah, that would be a good model.
Yeah, maybe a collaborative, with the neighboring community, and you get the word out. It's kind of a,
Yeah. Yeah.
cool,
What I've found
join forces.
what I've found historically, and it could prove untrue in this, what we're going through, but historically, if Malden opens up a clinic, you don't get a great Winchester turnout, for example. It's just historically that's how it's been. But this is just a very unique time right now, and perhaps people would be willing to go to a neighboring community to do that.
Yeah, so far away, Mike, you have your hand up.
Thanks, Susan. Sorry, my last question, I promise.
Okay.
Jen, do you think that, in light of kind of the staffing issues there, that it would make sense to look for a more permanent staff support for the health department? Because, if we're relying on trying to fill gaps with people going on vacation and everything, I mean, it seems like we're going to be into this for a while, and we may have better luck hiring someone more permanently rather than just or semi-permanently if we're so just to your request that you made, the financial request there, is that something that we should consider as well?
Right. So you're saying it would be a consultant position?
Yeah. Someone that could help with the communication end as well as the staffing the clinics. Or I don't know if that's something that you would need, but it seems like it would serve the residents well.
Yep, sure. I can look. It's just a matter of where am I going to find that medical.
Well, I mean, there's people that live in this town that might be willing to serve the community and volunteer and do it on a per diem basis. I don't know. I mean, I could be, Kathy, you might know better than I would, but I mean, I don't know if there's somebody available. I mean, certainly we can make, in my opinion, making those funds available. I think that's, a need. I mean, talk about unsung heroes of this pandemic. Kathy Whitaker is right up there. I mean, she's delayed her retirement. She's retired now and she's still serving the community before she goes to Florida. So yep. She's been a tremendous resource and is irreplaceable. But I mean, it'd be great if we can get, one or two people that we can rely on, to fill in and assist the department.
Right. It absolutely. I agree with you, and I will look to do that.
All right. So if there's no further discussion, or if there is, let's go ahead and have it. But I think we should really consider just approving what Jen has put together based on what she knows works and is effective so far, and without delaying anything any further. Let's roll this out.
So I think I would focus on the bottom line here, which is 295,000. And there's obviously a lot of good suggestions that have come forward tonight. I'm sure as the next few weeks go by, we'll find some other areas where we think it might make sense to make some changes based on, what we learn over the next few weeks. And so I think we should, again, just focus on the bottom line here, and then let the school department, the health department, with assistance from, DPW and town managers, figure out how to best allocate these funds. This is obviously kind of our initial thoughts of how it will work. But we might need to kind of move some things around as things come up over the next few weeks.
Yeah, no, that's a good point. That's a very good point.
Beth, would all the money be transferred to the health department account, or does some of it need to be transferred to the schools?
So it's a dedicated, Stacy's created kind of like a dedicated account for, in the past, when we got the previous, I think it was 171,000, Stacy created a dedicated account for that ARPA. So it's not actually transferred to either department necessarily. It's things are charged against that account, like the contact tracing services that were provided for in the previous allocation.
And I guess I just want to be clear that the 145,000 that we authorized at the end of, or the beginning of December, that's
171.
171. Okay. That's been spent at this point and allocated?
No. So that was intended to cover, based on what Jen knew at that time, and Jen, you can correct me if I'm wrong here, was intended to cover contact tracing and clinics through the end of June. So obviously that was based on I think 350 tests a month. Now we're seeing at least two weekly tests. We're having, up to 400 people testing clinics a week. So 800 people total a week. So, that was based on assumption, what we were seeing last fall. And now we're obviously ramping that up. So this additional funding is to recover that, that cost.
So just so I'm clear, in addition to the $171,000, you're asking for an additional $295,000.
Correct.
So $500,000 of allocate for this effort. Is that what I'm understanding?
That's the request. Yeah. So to add the additional 295,000.
But we haven't spent.
Jen, do you know exactly how much you've spent out of that previous?
It only became available January 1st, so I've just literally started spending from that right now. So whatever I don't use, I will get back. And also, I believe, what did we get? 6.8 million for the town.
Yeah. I don't think the problem is that we're not going to spend this at some point, and that's why I'm saying we don't focus necessarily on each of the bullet items here,
right?
Because as time goes on over the next few months, based on what we had approved in December, we've already had to make some significant changes to that in terms of the number of clinics we're going to see. And we may feel like, after we get this first at-home testing kit, 15,000 seems like a lot, but maybe we'll go through those in a very quick time period, and maybe we feel like we need to get another batch. So I think this request gives us enough flexibility to be able to do what we can to stand things up as quickly as possible.
So I'm fine with allocating the money. I guess I do want to see action with it. So I guess I would ask that, Jen come back and give us a report in 2 weeks or at our next, if we have a meeting around that time. I don't know our exact schedule, just to see.
January 24th would be the next meeting after this Monday.
Okay.
I mean,
I
was going to say that should give her some good data. See if more people show up. If something is free, if it's not impactful, then we won't offer it free. That sort of thing. I think they'll be. I agree. We should get a report, and everyone should be monitoring this and being sure that we're using it in the most effective way.
I don't mind doing that at all. I do know that I am not available on that night. I apologize. I can send a written report or send an emissary, whatever you like.
Okay.
I think it could be just part of Beth's, town manager report as well. I don't think that you need to necessarily report it,
right.
But as long as we just have a brief discussion of where we are, I think that would be helpful.
Yeah. Thanks. Yeah, that makes sense.
And so I move that we allocate $295,000 from ARPA funds into the COVID-19 mitigation account.
Second.
We have to do a roll call vote. Rich?
Yes.
Mike?
Yes.
Mariano?
Yes.
And I vote yes as well.
Thank you.
So this has been really interesting, and thank you all for spending yet another hour or more, and for putting this together so quickly. Thank you.
Yeah, I just want to thank everybody involved, because it's been a very, obviously for all of us, a very challenging 18 months, and this past few weeks and the month ahead are going to be even more challenging for us to move through. So just appreciate everyone's efforts.
And everyone on the health department team, thank you as well. I know people have been clocking a ton of hours. Our nurse lead put in for 70 hours last week. So these people are dedicated, absolutely dedicated. So thank you to the entire team.
Okay, Kathy, anything you wanted to add as chair? And your board meets on Monday as well?
On the 10th, correct.
On the 10th, right.
Yeah. And I do have some ideas about outreach to people for getting some additional help, nurses, maybe some other EMTs that I know that might be able to come on board and help us to increase the number of clinics that we're offering. And I'll work with Jen on that. And so yeah, we'll report back and see what we can find.
Yeah, no, that's excellent because I'm thinking there's a very limited supply of really dedicated retired nurses, and there's a limited supply of nurses because they're all working in other jobs and other positions right
Right.
now. I mean, it's just a tough thing to find.
It
Um,
is.
Kathy, is in your agenda for the 10th, is it to review the Be Together, the Boston vaccination mandate, since I think that's your last meeting before the 15th when it goes in effect in Boston?
Right, we're working on the agenda now, and that most likely will be something that will be on the agenda. Yes,
Great, thank you.
you're welcome.
All right, is everybody okay with wrapping up? Any last comments, thoughts? All right,
Thank you very much.
I move we adjourn.
Second.
roll call vote. Rich,
Yes.
Mike,
Yes.
Mariano,
Yes.
and I vote yes as well. I'm going to be doing that